Hi and welcome back. This is Dr. Dave. What is the single most important thing you could do to right-size your immune reactivity during these times of cold, flu, and yes, I said it, the COVID-19. Drum roll. You know what I'm going to say. Get your sleep, right? Sleep deprivation, particularly chronic sleep deprivation, wreaks havoc on your immune cells and their ability to respond appropriately to an infection. What do I mean by that? Well, they have to be active enough to combat, fight, kill the bug, but they can't be so exuberant that your own immune reaction ends up being what kills you, right? And that's what we're seeing a lot with COVID-19 virus. It's not necessarily the bug that's killing you, it's your own exuberant, excessive, inappropriate inflammatory response to the virus. All right. So number one, make sure you're doing the usual good, healthy things, number one of which, of course, is sleep. We've known for years that if animals don't sleep well, they die. Well, what kills them? Systemic infection. We also know that if you are sleep deprived, you have a 300 to 400-fold increase in getting pneumonia. And then also, if you're sleep deprived, you're not going to be able to generate lymphocytes, natural killer cells, macrophages, other immune cytokines, interleukins, etc., right? So what do? Well, I preach the good word on sleep hygiene. What does that look like? Go to bed the same time every night, get up the same time every morning. I don't care how much sleep you've had, you have to get on a routine. Second, turn those appliances off, right? Don't go to bed watching TV on your cell phone, on your iPad, on anything else. Right, just make sure that you turn off all electronic forms of light 30 minutes before going to bed, okay? Next, make sure your room is pitch black, particularly the older you get, the less light that's needed to intrude into your sleep, right? That's because your pineal gland is tanking already. Every hormone has its pause, so too does your melatonin. So make sure your room is black. If you cannot sleep, don't sit there and toss and turn and worry and fret. Get out of bed. Do something quietly, particularly if you live with anybody else. Just get something done. Fold some laundry. You know that it's right there in that basket where you left it earlier today. Right? These are just a few. There are many, many more. Don't drink a lot of caffeine, a lot of alcohol right before going to bed. Don't exercise rigorously right before going to bed. Back in the day, we used to say our prayers, our vespers, our meditations, and that always made sense because it lowers your excitatory, wakefulness promoting neurotransmitters, cortisol, dopamine, norepinephrine, acetylcholine, histamine. You get the point, right? So do something nice and relaxing and calming before going to bed. Lastly, you can always take a little bit of a natural amino acid based supplement approach, which is what I do, especially when I travel. What I take is the GABA boost almost every day for night, and then also during the day for breakthrough anxiety. That's this regular GABA boost, that it supports GABA naturally 3 different ways. We'll get into that later. Then I also take GABA boost PM that has, in addition to a little pharma GABA, the usual herbs that you would expect to be in a good sleep preparation: valerian root, chamomile, lemon balm, passion flower, hops, and then it also has some melatonin in it. If that don't work, then I may occasionally take a prescription sleeper. The only one I use, the only one I prescribe for my patients is Belsomra. We'll explain that mechanism of action later. I like it because it is not habit forming and doesn't lead to some of the other complications that you can get with other prescription sleep medications. What else do I do? Oh yeah, I'm always taking serotonin support. I take mine in the form of Serocore, which has in it 5-HTP, the basic amino acid building block for serotonin and melatonin. All right, so that's what I do. GABA Boost PM, Serocore, rare occasions prescription strength Belsomra, and then I always try to exercise good sleep hygiene. All right, you should do it too. Always, but particularly during this time of increased viral threat. Okay, Dr. Dave here. Nice to see you. Bye-bye.